This is my audience. Hello, my name is Samuel Snyder and I'm going to inform you about keratoconus. Does anyone that you know of suffer from any kind of disease? I'm going to inform you about the disease that I personally suffer from called keratoconus. I don't think most of you know what it is. Can anyone even guess what type of body part it affects?
The leg.
No, it does not. It does not affect the legs. But there is some ways to treat this disease. There is no cure for it, though. With any type of treatment or surgery performed, there are good and bad outcomes that come with it. To get you more familiar with the disease and the topic we are going to discuss, here are some three main ideas. We're going to discuss what the disease is exactly and how it can affect one person that has it, the ways it can be treated, and the different outcomes from the treatments. It can be a very scary disease that most people know nothing about. It's a disease that affects the cornea of your eye. It's characterized as a corneal dystrophy, which means that the cornea is not getting enough nutrition, so it's very weak and it thins out and basically is wasting away. This information was brought to you by the Corneal Genetic Eye Institute. This disease is mostly found in young teenagers and young adults. I was around 17 years old. I was a junior in high school when they found it in my eyes. So basically, the corneal bulges outwards, kind of making it a cone-shaped instead of being a flattened, smooth surface. It affects the vision significantly, making it very hard to see and distorting different objects, and distances can be very hard to judge. In some cases, glasses don't actually work as effective as contact lenses do. They had to make these special contact lenses to fit these certain eyes. Mine is a hard contact with a soft outer shell. I do see better in my contacts. I don't wear them very often because they are very painful to wear and they're very expensive, so I don't want to damage them. There are some ways to treat this disease, but before we go into it, I'm going to show you a visual aid. This is what the normal cornea would look like of a person without the disease, and this is a person with the disease that has it. See how it's bulging outwards, kind of making it shaped like a cone. So the most common way to deal with this disease is to go through a surgical procedure called corneal cross-linking. You can also get what is called an intact, which is basically a corneal transplant, but that's like last resort type of thing, and when it's so severe that there's nothing else that they can do. Most people don't go through the corneal transplant. They usually catch it early enough so they can do the cross-linking. I had the cross-linking done. Cross-linking, again, there is no cure, so it is not a cure. It just tries to halt the progression of the disease. So some surgical techniques. The surgeon removes or weakens the epithelial layer of your cornea, which is that first layer of the cornea. After removing the weakening layer of the cornea, they put drops of riboflavin at 0.1%, and they are given at intervals from 1 to 5 minutes for about 15 to 30 minutes. It kind of depends on whether they can see the riboflavin going in and kind of how severe the disease actually is. After adequate riboflavin absorption, the patient is positioned under the UV light at a small distance from about 1 to 5 centimeters away from the cornea for about 30 minutes. After the surgery, antibiotic drops are prescribed by the surgeons for patients to do them daily, 3 to 4 times daily actually, and then after the actual procedure is all done, a contact bandage is put on the eye. This is all explained in Erica Burnfield's article. This is another visual aid. This is an actual image from me going through this procedure. This is the UV light kind of burning in the riboflavin in my eyes. It's all absorbing in there. It's kind of a scary image, to be honest with you. With every surgery performed, there are outcomes that affects the change of medicine along with the patients being worked on by the surgeons. According to Mirko Jamfko, the surgery can reduce corneal curvature, can reduce cervical equivalent refraction, and can reduce refractive cylinders. Also explained, the cross-linking can also prevent the need for a corneal transplant, along with extensive vision loss, meaning you won't, in the next slide explained, you won't restore previous vision loss, but it can prevent from vision getting worse. After the procedure, they experience some eye irritation. I can relate to all these effects considering I personally went through it. As you can see, in conclusion, I think I've fully given awareness to you guys about the disease and what it's about. I personally recommend, if you're having some eye issues, to go to an eye doctor to get checked out for multiple diseases. Keratoconus is just one of many that can affect your vision and day-to-day life. So things that we then discussed that I have showed you, how it can be treated, what it is exactly, the outcomes of the treatment, and I hope that could be helpful in any sorts of ways down the road if you ever have any eye issues. Thank you for listening. I hope I informed you. Here are just some references that I have used in my presentation throughout. And then that image, the visual aid at the beginning of the slideshow, was from Google Images at this website. Thank you again for listening, and I hope I was very informative.